Good evening. How's everyone? My name is Elian Ramos. I'm ERD Goddess, and I want to talk about something that is very important tonight. For the past year or so, the Affordable Care Act has been making health insurance affordable and available for a lot of people. As a matter of fact, the last count was 10.5 million people who were already getting health insurance. But what happens is that a lot of us who, especially people for whom the cost of health insurance was a little cost prohibitive before, do not understand necessarily all of the terminology that is associated with health insurance. For example, you have the whole grandfathered insurance, and you have a lot of these other crazy terms that you may have never heard of. So tonight I'm going to be speaking with a couple of experts who are going to be answering a lot of the most common questions that we get all the time about health insurance and what the terms mean, but also how to maximize the benefits for yourself and for your family. I have two dear friends here who happen to also be extremely knowledgeable about health insurance. I have Gina Rodriguez, who is the Director of Latino Affairs in the Office of the Secretary at the Department of Health and Human Services. How are you, Gina?
Hello. Thank you for having us.
And then I have Vanessa Gonzalez Plumel, who you probably remember. She's been here before, and she's the Director of Latino Leadership and Engagement at Planned Parenthood. How are you, Vanessa?
I'm well. Thank you so much.
Did I pronounce your last name right? Plumhoff?
It's pretty good. Plumhoff.
Yep. Plumhoff. Very good. It's German or something.
Yes.
Well, thank you both for being here, ladies. And so let's start with a question, a very basic question. Okay, let's start with a basic concept of health insurance. What is health insurance? Who wants to go first?
I can take that. So it's kind of like a tricky question because it's like it feels like it's something that we all know because this is what we deal with in every day. But it is something that we are struggling with to convey that to the community right now. So what it is a contract that requires your health insurer to pay for some or all of the healthcare costs in exchange for a premium. And then health insurance coverage is the legal entitlement to payment or reimbursement for your healthcare costs. It's generally under a contract with a health insurance company or a group plan offered in connection with employment or a government program such as Medicare, Medicaid, or CHIP or the Marketplace.
Vanessa, you want to add anything to that?
Yeah, that is. Thank you, Gina. That was a great spot on definition. I think another thing is health insurance is what you need before you get sick. Health insurance helps you have a little bit of peace of mind from a family perspective, from a personal perspective. Nobody thinks that you're going to get sick. Nobody ever really thinks that they're going to be in a car accident. You know it might happen, but it's not until it really does, I think, that you understand the severe significance that those healthcare costs can have on you if you don't have health insurance. So health insurance literally is that, an insurance on your sanity sometimes, on your peace of mind, and just a nice way to make sure that if something does happen to you that's unexpected, you've been paying that health insurance company, their insurer, you've been paying well with the contract, and so when something does happen, you have that card that you can hand over to the emergency room, to the doctor, to the physician or the nurse, and be able to say, here you go, I know what my costs are, I know that I can receive coverage for much less than you would if you didn't have health insurance.
That's excellent, Vanessa. I couldn't agree with you more. It's a peace of mind, as people are just one accident away from going into bankruptcy, and that's a really great way to explain it.
And it's amazing because so many times, I mean, those of us who who drive, we all have car insurance, right? But we never think of having insurance on, what if our body breaks down, God forbid, So it's great that that the Affordable Care Act now has made it available to so many more people, So speaking of that, how does the Affordable Care Act, how has it changed the way that insurance works now?
So the Affordable Care Act has offered a lot of protections. Even before the marketplace opened, it really strengthened the entire infrastructure of the market. So now, for example, women can't be charged more than men for this exact same coverage. And also, before people would would have serious, or not even serious, like say asthma, they would be they could be charged more, or they can be cut out of the market. And in some instances, there were some situations where we identified that health insurance companies were going through and identifying like potential coding and finding people who had very serious illnesses like cancer, and then cutting their coverage off because they say they found an error in their application, and they don't no longer have the rights to cut people out of the market like that, so arbitrarily. So it strengthens the infrastructure for everyone, even before, and it continued to, so it sets a floor. So the floor is like the 10 essential health benefits that now everyone can have the peace of mind knowing that they have. So some people who were paying a lot of money for coverage, in the individual market in the past, when like a woman got pregnant, discovered that it didn't cover maternity care, for instance, or when you went to the hospital in the ambulance, and then you realize that it didn't have that. So now all of the essential health benefits are covered, and you would think that some of these things are the things that we would think that were very, would definitely be included, and that was not the case. So it offers a lot of protections for the entire market, but for now the newly insured, it offers a great deal of affordable access to care that they would otherwise be shut out of the market thanks to the subsidies.
Mm-hmm.
Yeah, and one of the key points about that is that preventative care is now covered under Obamacare, and that is something that's new. Whether or not you need to go in for your cervical cancer screening, your annuals, you can come in under the Affordable Care Act, and all of those preventative services are covered, and that's phenomenal, particularly for women who oftentimes need to go annually, need to have some checkups. We have a very special anatomy, and there's special things that need to be looked at, and so being able to have that peace of mind that is now covered and that you have a right to those services, that has definitely changed the conversation when we talk about health insurance. We're also seeing a lot of people who for the first time are having an interaction with the health insurance and healthcare system. Many times, particularly in the Latino community, we know that we will go without care, particularly if you're a Latina mommy. You may decide, you know what, everyone else comes first. And so really trying to urge women to take care of themselves, because if you're healthy, then the rest of your family is healthy. But that awareness of the community and that awareness of people of like, wow, I have rights to this and I should be able to walk in and I should be covered and I should be seen, I think is going to be really influential in the way that the healthcare and health insurance systems change in the coming years. So it's definitely not just a one-year type of event. It's an ongoing continuation and hopefully an evolution in the systems.
Mm-hmm. And this is why we need to kind of get the basics down, right? So speaking of the basics terminology, one of the terms that confuses people is the health exchanges. What are the health exchanges? Can you explain that? And how can one buy exchange-based health insurance? Who wants to answer that?
So I can give you the
Gina set them up. That's all, Gina.
I can give you the technical definition, but I'll leave it.
Give me the technical definition, but also like the definition that we can all understand.
So the marketplace is a resource where families and small businesses can learn about health insurance options, and they can compare the health insurance plans based on costs and benefits that are offered. And it also provides information on programs that help individuals with low or moderate income. And it provides many ways to save money on premiums and out-of-pocket costs. And it also helps to guide folks through the process. So if if you go through the process and your family might be like say your children might wind up being eligible for CHIP and Marketplace, and like the other part of your family for Marketplace, all of that it's through one-stop shopping. So you can enter through the same place. And in the only caveat is that in some states the Marketplace is operated by the state because states were offered that flexibility, and in others it's run by the federal government. So those are the federally facilitated marketplaces. So that's what it is technically. So
very cool, very cool. And so so now we understand that health insurance is available, and now we kind of have an idea, a little technical idea about what the health exchanges are. So what does one have to do to get the process going?
So there's a couple of different options. I'll talk about some of the organizations who are providing that option, and then Gina can kick it over to the Cuidado de Salud and all of the nice government websites that we're all supportive of and kind of feed everybody to. There's a couple of different options. One of the first, before that, it's really about educating yourself on what you really need before you even start the actual enrollment process. So at Planned Parenthood, healthinsuranceFacts.org, you can find a lot of the information that you need and things to consider, at least particularly for women as they're looking at healthcare. In Spanish, we have PlannedParenthoodAsegurate.org, and I think we can send around those links a bit later on the technical side of sending them. But if you look at those two sites in English and Spanish and really sit down, there's also a cost calculator on how much it could cost to cover your entire family, as well as information about the tax subsidy, essentially the help that you can get that you might be eligible for if you need help paying monthly, and how much that can lower your costs annually as well. So it's about educating yourself. What's your personal and your family history, medical history? What are some of the extra needs that you might need? It also is going to depend upon what state you live in. At Planned Parenthood, we're big believers in that your health care should not be dependent upon your zip code. Unfortunately, that is not always necessarily the case. And so that's also another factor to take a look at. On our website, you can begin the process. You can educate yourself, and then you can actually begin the process. Now, we're currently in a special enrollment phase, and so people who have had big events happen in their lives, if you had a child, if you adopted, if your immigration status has changed and now you're eligible, these really big events, you can be eligible for special enrollment. Actual open enrollment itself doesn't begin until November 15th. And so you have plenty of time to get educated if you don't qualify for special enrollment. And really, on November 15th, there's going to be a ton of organizations that are going to open up their doors and have navigators and in-person assistants bilingual, who will be able to help walk you through the process. At Planned Parenthood, working with our partners, such as the two of you, as well as the wonderful folks at LULAC, NCLR, Hispanic Council on Aging. There's so many, National Latino Institute for Reproductive Health, a ton of other great partners, and of course Enroll America. Through those efforts, we're able to touch, we count 2.45 million people. Wow. And so many of those efforts focus on communities of color, 75% of those focus on Latinos specifically. And so we know that one of the really important things is that in-person assistance. So I would really recommend checking out the different websites, making sure that you have all the materials that you need, so that when November 15th comes around, you can either go to an in-person event, where again you'll have some bilingual assistants, people sitting down and helping you through the process. You can go online to our websites, to the Enroll America websites, or to the HHS websites and begin the process there. And there's also a 1-800 number that I'm hoping Gina can remember right now. There's a 1-800 number that can also help you start down that process. A lot of options.
So it's 1-800-318-2596.
Good, Gina. Thank you.
Yeah.
So now, Gina, do you want to add anything else to that?
Well, I mean, that was an excellent overview. I think the only thing that I would add is that we currently, you can still dial in now, and in case you might be eligible for a qualifying life event. And also that Medicaid and CHIP enrollment doesn't have, it doesn't close. It's ongoing throughout the year. We have hashtag Enroll365, so you know, so to remind folks that you can enroll all year round. And also that just with when folks turn 26, that they're again eligible for special enrollment periods and at the birth with all those qualifying life events like the birth of a child or change in marital status as well.
Mm-hmm. So let's talk about a little bit about the kind of preventative services. I know, Vanessa, you mentioned earlier that there's a lot of preventative services that are now available under the Affordable Care Act. Can you talk a little bit about what those are and how can people take advantage of them?
Yeah, absolutely. If you, I'll just start on our side. If you have insurance under the Affordable Care Act, you are entitled to preventative services like the cervical cancer screenings. We know Latinas really do suffer from really high rates of cervical cancer. So now you can go in and you can get those. And we have heard stories of women in their 50s and their 60s who never have had the screening done. And at the enrollment events around the country, when they're able to say, I can go get this done, I haven't been to a doctor in decades, you know, for various reasons. And so you can go get that done now without fear. Diabetes screenings, you know, your annual exam, those types of things, blood work, those are preventative services in the way, essentially screening, right, to catch all of these possible issues before it gets too late and moves down the line.
Mm-hmm. Right, and I think because Latinos suffer at higher rates for chronic illness, many of the preventive services are really tailored in such a way that they really help our community a great deal. In addition to the ones that Vanessa mentioned, we have like blood pressure screening, cholesterol screening, colorectal cancer screening, depression screening, and as you know, that's really huge, particularly for Latinas who have the highest rates of attempted suicide, and of course diabetes screening, HIV, immunizations, obesity screening and counseling, and the list goes on. And I think this is extremely imperative, particularly for women and Latinos because of our chronic propensity for chronic illness.
Mm-hmm. So now let's talk about, a lot of our viewers are self-employed or they are entrepreneurs, you know, who have their own companies. How does the Affordable Care Act work for people like that who own their own a small business or who are, you know, freelance workers and that kind of thing? Who wants to explain?
So I can take that. So for the employers who, if they have less than 50 employees, they can go into the regular health insurance marketplace. But for those for more, they can go through and shop in the SHOP option, which is SHOP is the Small Business Health Options Program. And we are actually working in coordination with the Small Business Majority and the SBA and providing webinars to provide that information in great detail in English and in Spanish. So I'm happy to send links to those webinar announcements because I think we'll find it very useful for the community to have that right on hand through your resources. Thank you.
Mm-hmm. So I'll, you know, you've been mentioning a lot of these links and resources, and I'll have all of that readily available on my blog. So I'll be posting all of the links to everything that has been mentioned here in a couple of days. So let's talk about now what are the options for the people who miss the regular enrollment period. I know that you mentioned something about special enrollments. How does that work?
So for people who face like the qualifying events, those are the huge events that Vanessa had mentioned previously, they can still enroll. They can call the 1-800 number that we mentioned and or go online and still go through to see if they qualify, and they can still get through.
Okay, Vanessa, you want to add anything?
Yeah, I just want to say I think it's really important to go onto any of the websites and really look through the list of qualifying life events because, like I said, they're pretty big events in your life, right? You have a different marital status, a change in citizenship status as well that allows you to qualify. Even moving to a different state, it's really important that if you do move to a different state that you make sure that you know what that state covers and what's available to you in your new location.
Mm-hmm.
Oh, the only shameless plug that I would add is hashtag born in '88. So for individuals who are they've turned 26 and they no longer qualify to stay under their parents' plan, another ACA protection that was offered, they can now have they qualify for a special enrollment period. And I encourage you to join our thunderclap. If you look up hashtag born in '88 or nacido en 88, you will find the links that you need to join our thunderclap and obtain ongoing information.
Yeah, and this is this graphic that you can see now on the screen is a graphic that was put together by Young Invincibles, which is an amazing website. It's a great resource that explains how the whole Affordable Care Act works for people who are 26 or over. You know that there's a cutoff period there where you no longer can be under your parents' insurance, and so that explains the whole how you can continue having coverage after that. All of this is going to be also in the blog post. And so now I know that you two especially out of the whole coalition have been going around the whole country teaching people about the enrollment periods and about all of the requirements to get into the health insurance. Can you tell me a little bit about those events that you're having and where are you going next?
Yeah, I'll go ahead. I can take this one. Been an amazing coalition of people who have come together and organizations that come together to make sure that that our community knows as much as they can about enrolling in Obamacare and what that means. We've gone to Miami and different places in Florida, Texas, California. I mean, we've gone all across the country, and we've enrolled, we've gone into farm worker communities to make sure. One of the really important keys for the Hispanic community is that a lot of us live and do live in mixed status families. And so while maybe the parents are not citizens at this point, maybe the children were born in the U.S. And so we're going where the community is. And when you come into these events, it's really phenomenal because we've had over 500 people at some of these events. There's lines around the block, around the building, and people leave crying. And so I will say that it is one of the best things I've ever done in my life when a person feels like they can go to the doctor now and they can go get these services and they can go get no-cost birth control. It's amazing. And really feel empowered to take care of their health and their life. At these enrollment events, just so everyone knows, we ask, again, that you do your education and organizations will help you with that and what to bring and what documents you need to bring. And when you first show up, sometimes at these events you may need to make an appointment. Sometimes it's just everybody does a walk-in, and to be honest, with our community, a lot of times the walk-in is a lot easier. And sometimes there's different services for children at these events, and there's different social services for families. Sometimes there's food, a bouncy house we've had at a couple of events. And so you walk in and you're first essentially screened if you qualify for your state health insurance, if you need additional information on Obamacare, or if you're ready to enroll. And you may wait a little while because, like we said, over 500 people. So you wait a little while, and then you're pulled back into the appropriate area to sit down at a computer with a navigator or certified assister and really walk you through the process. These people are amazing, and they can do it in English or Spanish. And they will sit down and they will go through all the questions. They will help you. One of the key things that we kept running into is that a lot of the members of our community didn't have email addresses and weren't really sure how to set that up because they've never had a need to have an email address. And so for some folks, that's our first step. We're literally sitting down with people and helping them create an email address where they can receive the correspondence. From there, we continue all the way through the process. Make sure that you are aware of the tax subsidies that you might qualify for. Make sure that you have some understanding of the rights that you're now qualified for. And then let you know, okay, here's kind of the timeline. Here's what you're looking at. Here's the phone number that you can contact for follow-up information. From there, you leave the desk or the table that you've been sitting at. You walk out, and one of the things that is really important to us is to be able to capture your story. And so you may get asked from someone to either fill out a card, to do something on camera, to really make sure that everybody understands two things. One, that the Affordable Care Act is working and that it is really valuable for our community. And for another thing is to make sure that people who were skeptical, excuse me, that word. It's late here.
People don't believe it.
Yes, people don't believe it. Or who were really nervous for whatever reason can see another person in their own community saying it worked. There's nothing to be afraid of. This information is only for health insurance purposes. We know that that was really important to tell folks at these community events, that the information that is provided will be used for health care. It will not be used for any type of immigration process. That information is not shared. And then, of course, if you like our service, if you support us, you know, Planned Parenthood health centers across this country see over 3 million people every year. A growing percentage of that is Latinos. About a quarter of it now is Latino communities, men and women. And so we would ask that, you know, you sign up for more healthcare information from us, and then we will happily continue that process.
Awesome.
So the only thing that I would add, and thank you, Vanessa, for that great overview, I would just reiterate, because I want folks to be clearly aware that even ICE, the Immigration Customs and Enforcement Agency, they issued a memo, and we can provide a link to that to show that we will not be using any information collected neither on-site or via the marketplace website, the health or the Cuidado de Salud, that will not be used against anyone, even in the event of mixed status families. So I just really wanted to reiterate that and underscore that. And another great opportunity that we had is to ensure that people know about the tax subsidies that they're available to individuals up front. The advanced premium tax credit, they can obtain it right up front so that they can see those discounts immediately rather than waiting until tax time. And then what we're going to be working on in the interim are health literacy events, or it's an opportunity to learn about the marketplace essentials. So even before open enrollment opens, we want to make sure that individuals know how to effectively utilize their coverage, their current coverage. And for those that were unable to register for whatever reason, we'll screen them to see if they might be eligible through a special enrollment period. And if not, then explain the basic terminology. Because oftentimes I think what we're hearing is that individuals think, you know, I have coverage, and then they go maybe they were used to going to the hospital, and they don't realize that, no, you have to, you know, select your primary care physician, or that they don't understand that, like, when you go to your primary care, then you might have cost sharing, or you might have a copay, might be so explaining all of the impact of selecting the different plan types and the metal types, so that they can understand at the time of utilization what that means. So we're going around in this campaign and continuing to provide that level of education and outreach, so that individuals can be prepared for the next go-round, and those that were able to enroll successfully know how to maximize the use of their insurance options.
Fabulous. And do we know yet what cities the whole health literacy tour is going to? Can we talk about that, or we don't know yet?
Yes, no, I do. And it's not limited to these. I think some of our partners are going to do some additional cities, but the ones that we're focusing in on are El Paso, McAllen, Dallas, Houston, San Antonio, Miami, Orlando, Phoenix, Atlanta, North New Jersey, North Hudson, Philadelphia, and Charlotte. And I think our partners are going to focus in on Los Angeles, New York, Denver, and Chicago.
Wow.
So we have our work out for us, and it's a really exciting opportunity to engage directly with the community.
So now we'll see you even less, right? You're going to be on the road the whole year.
Yeah. I will say also, though, you don't need to wait for one of the literacy events around the country. There's plenty of information and resources out there to start the conversation. However, if you do have questions and you want to just sit down and talk to someone, this is the time to do it, and we'll set all of those up, and then we'll make sure that everybody sees that list about when we'll be where. But I would really stress that folks need to get online and start using those websites. Planned Parenthood, we have a nice, cute little graphic that describes, the process itself from entry all the way through, and then really defines in both English and Spanish what these key terms are, like a deductible, like a premium, all of that kind of new language for some people.
Mm-hmm.
Great. That's very true. One more shameless plug, if I may. If anyone wants to be involved in at the local level, if you're residing in these cities, please shoot me an email to latino@hhs.gov, and we're happy to collaborate. There's definitely a lot online, and we have a deck that if you're interested in helping us, like via a train-to-trainer approach, or want us to collaborate with you in hosting a webinar, we're more than happy to do that in the interim. We don't have to wait until we're there in person. Absolutely. Great point.
Awesome. And so speaking of not having to be there in person, where can people go to find more information? And this, feel free to do all the plugs you want, Gina. This is the time.
I'll let you go first, Vanessa.
So yeah, we definitely have, like I said, if you are in a city with the Planned Parenthood Health Center, you should feel free to walk in there and say that you want information on Obamacare, the Affordable Care Act, and you can receive information there. And you can also receive information by going to www.plannedparenthoodhealthinsurancefax.org, or for Spanish, www.plannedparenthoodasegurate.org, and you'll find a lot of information, just even some of the basics. What is the law? What are the things that a woman needs to look for in particular when deciding her coverage? We even have a questionnaire there that you can call prospective insurers if you feel like you really like a company that you want to go with and it's an option in your state. You can call them and ask them specific questions so that you're not surprised one day if your coverage isn't, if you don't have coverage for something. But I would really recommend going to our websites and checking it out. We also, if you are in a city that you don't have a Planned Parenthood Health Center, but maybe you have a LULAC chapter or a National Council La Raza chapter, and they also operate different types of organizations locally, you should feel free to walk in there too. I don't mean to speak for them, but they have been amazing partners, and be able to walk in there and say, you know what, I need more information on the Affordable Care Act.
Awesome.
And then our official resources can be found at healthcare.gov, or in Spanish, equidadodesalud.gov. And also, I would really strongly encourage you to visit the marketplace, .cms.gov, because there you can download official resources in many languages, not only in English and in Spanish. And then we have partner resources, and then we have resources that are tailored for the consumer. So so there's a lot that you can order, and we even you can even order from our warehouse. If you see something you like, you can order like brochures, like if I may, the Coverage to Care. This Coverage to Care brochure is available in English and in Spanish, and we have some videos that are helpful in English and in Spanish. The vignettes feature a lot of terminology that I think is very helpful, and if you can share that with the community, and we'd be extremely appreciative. Or if you want us to work with you in doing so, we're happy to help. And if you need the 1-800 number, we do have assistance in more than 150 different languages, and that number is 1-800-318-2596. So we're here to help any which way.
You heard it here, folks. And also, I'm going to be posting all of this information on my website, so you can find it. My website is, my blog is ergeekgoddess.com. So if you go there, there's a whole section there that is about the Affordable Care Act and all of the different hangouts that we have been doing in the past couple of months. So I want to give thanks to my guest tonight, Gina Rodriguez. It's so knowledgeable, and thank you so much for taking the time. I know how much work you have there at the HHS, so I appreciate you being here, Gina.
It's an honor. It's a pleasure and an honor to work with you, Lilian.
And Vanessa, as always, you are a repeat guest here, and I always love having you. Thank you so much for sharing all the information with us always, and for being such an amazing partner in this whole journey. So thank you. Go ahead.
No, I was to say thank you so much for having me again. I appreciate it. These are always fun, and any opportunity to make sure folks get access to healthcare, absolutely. So thank you for spreading the word far further than any of us could by ourselves. So we appreciate it.
That's what we're here for. That's what we're here for. And I want to finally thank everybody who is watching. You're going to be able to watch this whole broadcast again on my YouTube channel, which is youtube.com/user/ERGeekgoddess, Elian Ramos. And you're going to find it on my blog too, ergeekgoddess.com. I see you next week at the same time and the same place. Thank you and good night, everyone.
Thank you.
Bye.